Well, good morning, everybody, and welcome to this timely and important webinar. My name is Alex Padilla, proud to serve as your United States Senator. And I want to thank the following folks for joining us today. You'll be hearing from Assemblymember Bauer-Kahan, from representatives of the California Department of Healthcare Services, the Kennedy Forum, and the Steinberg Institute, to talk about some of the vital mental health care resources coming to California, including the new 988 Suicide and Crisis Lifeline. You know, for years, we've been working together to fight to end the stigma around healthcare and mental health, I should say, and to get Californians the resources and the support that they need. We know this was a big concern prior to the COVID-19 pandemic, but the last 2 years of the COVID-19 pandemic has exacerbated the challenge, has exacerbated the need. And so this work is more important than ever. You know, whether it's been struggling with the effects of isolation or anxiety or stress made worse by the pandemic, we have an increased awareness of the mental health crisis in America. And Americans need more support. That's understandable. And that's especially true for children across the country, many who have lost a year's worth of in-person learning at their school. And both kids and adults alike have dealt with limited social interaction when we were isolating during the COVID-19 pandemic. But particularly for kids that were learning remotely, they went all that time without the help or assistance of critical in-person school-based health resources. Like, I think there's everyone has a personal story to tell around a mental health struggle, whether it's something that we've been through individually or we know somebody in our friendship circle or in our family that has. And it's an issue that is personal for my wife, Angela, and we've been trying to do our part here in the Los Angeles area to bring resources and awareness around mental health. My wife, Angela, is a very active and effective, I might add, mental health advocate. And of course, for me, in my role as a policymaker, we've had the chance to work closely with mental health providers throughout the state and advocacy organizations throughout the state. And I can assure you there's so many people doing great work out there, but they need more support. That's why in Congress, I fought to increase funding for California's mental health resources. And we're starting to see meaningful progress for communities and Californians who need it. I want to give a couple of examples. Our COVID-19 relief packages included $190 million to fund education and health grants for school districts. These grants are helping school districts expand their mental health services and serve more children and families. I was also proud to be part of the passage of the Bipartisan Safer Communities Act, which is investing even more in school-based mental health care that kids, and particularly low-income families, often rely on. And I was proud to help secure over $11 million in federal funding for projects to expand healthcare facilities across California, growing their capacity to serve more families, particularly in the communities that need it the most. We've also been able to bring our state public health and public safety agencies together to have a better response, more thoughtful response to crisis situations. And today, it's an honor to join so many of California's mental health care advocates to promote the groundbreaking 988 hotline. Now, 988 is a national suicide and crisis lifeline that launched last summer to help anyone in California and across the country get connected to the resources they need. And I'm particularly thankful for the work of Assemblymember Bauer-Kahan for her work on AB 988 to implement the National 988 hotline here in the state of California. And because of it, if you or someone you know is experiencing a mental health emergency, you can call or text 988 for support 24 hours a day, 7 days a week. So again, if you're experiencing mental health related distress, or if you're worried about a loved one who may need help, by calling or texting, you'll be directly connected with a trained mental health counselor. The kind of accessible services is critical and timely, and I can guarantee you that this will save lives. But it's also clear that our work is not over. We need to do more to continue to help low-income and underserved communities, especially for the schools and students who still lack the resources that they need. That's why I'm fighting for legislation like my Comprehensive Mental Health in Schools Pilot Program Act to help underserved schools improve their mental health services, and why I'm so grateful to have the partners of everyone that you'll be hearing from today, and for all of you tuning in. And in the meantime, one last pitch. Anybody who wants to be helpful in this cause can help by helping us spread the word around 988. 988. Those 3 digits will save lives. Now, before turning it over to the Assembly member, I do want to offer a few words in Spanish. I understand some Spanish language press has tuned in, and so let me deliver a brief message. Gracias a todos por unirse hoy con nosotros para aprender más sobre los recursos y el apoyo por nuestra salud mental. Por años hemos luchado para erradicar el estigma asociado con la salud mental para que los californianos obtengan los recursos y el apoyo que necesitan. Por eso me he unido con tantos defensores de la salud mental aquí en California para promover la innovadora línea 988. 988 es la nueva línea de prevención del suicidio y crisis que se lanzó este verano para ayudar a cualquier persona en California y en todo el país a conectarse con los recursos que necesitan. Si usted o alguien que conoce se encuentra en una emergencia de salud mental, puede llamar o enviar un mensaje por texto al 988 y recibir asistencia a las 24 horas por día, 7 días a la semana, en varios idiomas, incluyendo en español. Al llamar, lo conectarán con un profesional de salud mental que les puede ayudar. Y también les pedimos que nos ayuden en este esfuerzo corriendo la voz sobre la línea 988, porque estos 3 números pueden salvar vidas. Gracias por estar con nosotros. And with that, let me turn it over to my partner, Assemblymember Bauer-Kahan. Take it away.
Thank you so much, Senator. And I so appreciate your focus on kids. You know, we're both parents and we understand what the last couple of years has done to our children. And it is so critical that we continue to lead them to the healthy place they deserve to be in. So I appreciate your incredible focus on school-based care and everything you're doing for us in Washington. Couldn't be more grateful to have you representing me and my family. I also want to thank you for hosting this. I think that AB 988 and the 988 system is one of the best examples of us working at every level of government. The federal government, the state government, our counties, Los Angeles, and where I live in Contra Costa have been incredible partners in this work, and our cities are doing their part to make sure they're building up a system that supports individuals who need care. So it's exciting to be doing that work across government for what people really need every day in their lives when they suffer from mental health crisis or someone they love does. To your point, it's rare that I talk to someone who doesn't have a story where they've been touched by exactly what it is we're trying to do here with the 988 system. So thank you so much for highlighting it. As the senator said, I'm Assemblymember Rebecca Bauer-Kahan. I represent the 16th Assembly District in the East Bay, up here in the beautiful Bay Area. And I was the proud author of AB 988 with the partners that you'll hear from on this call after me. And it was an incredible piece of legislation to author because my inspiration came from my very own community. A young man in my backyard in my community was tragically killed by police during a mental health crisis. His name was Miles Hall. And Miles's mother, Tawn, who couldn't be with us today because she's celebrating her birthday, happy birthday, Tawn, turned his story into powerful advocacy for change. And we worked with her to provide what will be a care-based alternative to 911. Individuals in California who are in crisis will now be able to call and get a healthcare response rather than a law enforcement response. And we know that this will save lives across the state, especially, as the senator said, for our communities of color and those who today need access to care and don't have it. At the same time, Congress passed and the president signed legislation establishing the 988 system. One of my favorite facts is it was passed unanimously through Congress. I didn't think we were in a time where that could happen anymore. But this was a piece of legislation that got bipartisan support because it is something that touches every single American. But implementation was left up to us. And we got to work here in California to make sure that we were taking the incredible flexibility that the federal government gave us to reimagine how we treat those in mental health crisis by providing immediate support for those who are suicidal or suffering. Additionally, the new legislation allowed us to provide immediate in-person support by those non-law enforcement professionals through mental health crisis response teams on the ground in your community. But as you probably know, state level implementation is not easy. Call centers needed funding. We knew that there was going to be an uptick in the number of calls coming into our crisis hotlines. We needed to establish an interconnection between 988 and 911. So if someone called the wrong number, we could get them the right services. We need to work to create those crisis teams for seamless deployment so people get the care they need where they are. We worked tirelessly with stakeholders to successfully secure $20 million in the state budget. Thank you to the administration for their incredible partnership on that and the governor. But that ensured us that the call centers, when they went live on July 16th, were ready with the professionals to handle the individuals who needed them. And we did that work. And as I said, no news was good news in July when the rollout happened. And then with the signature of AB 988, every Californian will know that they have a resource to call when they or a loved one are facing suicide or mental health crisis. It is as simple as picking up the phone or texting, as the senator said. The legislation at the state level does this in two critical ways. First, it creates sustained funding for Crisis Center and our mobile crisis response teams to get that behavioral health care to individuals in need. And that sustained funding is really important. As we know, the budget isn't always as generous as it was last year, but mental health doesn't go away, even if our budget dollars do. So making sure that that funding would be here in perpetuity was critical to our success. It also sets into motion a coordinated implementation process for long-term planning, making sure that up and down the state in rural counties and urban counties, we're setting our counties up for success to provide the care that people need no matter where you live and no matter what time of day it is, 24/7 everywhere in California, which is no easy feat. You'll hear from Stephanie, who is, that is her job moving forward. And it is just a really exciting thing for what the mental health crisis continuum will look like here in California. We know we have much more work to do, but it is an incredible start, an incredible access point into our mental health crisis system. I want to say how grateful I am to my colleagues who stood with me and voted for this legislation, including my Republican co-authors. This was a bipartisan piece of legislation through the legislature, and I'm incredibly proud that in this moment in time, we could stand together as they did at the federal level and fight for what Californians need. Our partners, the Kennedy Forum, the Steinberg Institute, the Miles Hall Foundation, and so many others, including our federal champions like our incredible Senator Padilla and Congressman Tony Cardenas, who was an incredible partner in this legislation and fights every day for funding in the House at the federal level. This is revolutionary. This is life-saving. And this is the work that each of you elect us to do every day to save lives and improve them here in California. So I just am so honored to have had the privilege to do this, to have had the support to make it happen, and am eager to continue to do the work to make sure it is successful and it meets the needs of every Californian, no matter where you are or what you need. As you heard me open with the story of Miles Hall, we didn't just fail him the day that he died. We failed him long before that, when he didn't have access to the care he needed to get him to a healthy place where he could thrive and be the incredible young man that he would have been. So we're changing the system, and we want to give you the care you need. And so as the senator said, please call 988 if you need support. Your life matters, you matter, and we want to make sure that we're giving you the future that we know you have, because each of you makes California brighter every single day. And with that, I will turn it back over to the Senator. Thank you.
Thank you, Assemblymember. Very, very well said. Appreciate your passion and your leadership at the state level. We'll now hear from Tara Gamboa Eastman on behalf of the Steinberg Institute. Tara.
Thank you so much for the introduction. It is such a pleasure to be here talking about 988 and celebrating the passage of 988. I just want to echo the thanks and inspiration that Assemblymember Bauer-Kahan shared of what a privilege it is to be in California and to have such champions at the federal and state legislature, state level in our legislature, and also in the administration. I think really with kind of all of those leaders across the spectrum, we were really able to achieve something tremendous, and there's so much more to come. And so it's such a joy to be here and celebrate that with you today. And also along with the Kennedy Forum, we were both very proud to co-sponsor Assembly Bill 988, which really is transforming the way our mental health crisis system works in California and across the state. For too long, our mental health system has really stigmatized and criminalized access in the country and in the state. And the result has been tremendous and unnecessary suffering and loss. Suicide rates have been skyrocketing in recent decades. And in the last 10 years, 1 in 4 fatal police shootings have been of people in the midst of a mental health crisis. And 988 really gives us the opportunity to break down this stigma and to finally respond to a mental health crisis with a mental health response. And so this new national mental health crisis number that launched this July, right now in California, you can call or text 988 and be connected with a live trained mental health professional. But the full vision for 988 is for everyone to have someone to call, someone to come, and somewhere to go. And by passing 988, AB 988, California will ensure that this full vision is realized and that every Californian has access to the appropriate crisis services when they're in need. As Assemblymember Bauer-Kahan mentioned, AB 988 does this in 2 critical ways. One, it sets up the state planning process and implementation process to connect the 988 crisis call centers with those mobile crisis teams instead of law enforcement, and ensure those that are in crisis are connected with the ongoing services they need to recover. This is going to be a lot of work, and really look forward to hearing from Stephanie later from the Health and Human Services Agency on their work there, and just really appreciate her and Secretary Mark Galley for their leadership on this. And then also we have set up a really critical piece to the system, which is that ongoing funding. The federal legislation that established 988 allowed states to charge a small fee on phone bills. This is the same way that 911 is funded across the country. And we're talking literally pennies on the dollar, 8 cents a month for the first year with a lifetime cap of 30 cents, which will make sure that Californians always have access to this resource. And California is only the 5th state in the country to pass 988 legislation, including this fee. And so AB 988 is not only important for California, but important for the country as it sets a precedent for other states to follow. California has once again proved that we're a leader in mental health, and I am so proud to have been a part of that with such tremendous leaders in Senator Padilla and Assemblymember Bauer-Kahan, and really look forward to knowing that Californians can take heart, knowing that AB 988 will always be there, and that the number will always be there for folks to call. So thank you so much for having me, and thank you for your wonderful work.
Thank you, Tara, for all the work that you do and everybody at the Steinberg Institute. Next, we'll hear from Lauren Fink from the Kennedy Forum. Lauren.
Thank you, Senator. I'd like to echo the thanks expressed earlier. The strength and comprehensiveness of AB 988 is really a reflection of many, many important voices, from people who have had to call a lifeline for themselves or a family member, to experts who work along the crisis continuum, either as community providers or emergency responders. Our country has spent decades building up a system of emergency response for physical health services, and our country has also long had an antiquated approach to responding to behavioral health emergencies. Today, with bills like AB 988, we are fighting for equity in our mental health emergency response. At the Kennedy Forum, we are committed to transforming the way mental health care is treated in our country's larger health systems through quality of care, through technology, through parity with physical health. No matter your situation, your insurance provider, or your location, quality and accessible mental health care should be there for when you need it. AB 988 has taken a huge leading step forward in accomplishing just that by setting out a comprehensive plan and a funding for crisis services access to the 988 number. AB 988 has the potential to really transform crisis mental health care in California, ensuring Californians in crisis have access to appropriate care, to trained clinicians and quality care at the moments in their lives that they need it the most. 988 offers an opportunity for states to choose a different, more equitable path by creating a system of mental health services to help individuals in need, shifting away from the damaging punitive response that is all too often the status quo. In addition to being a number to call, 988 can also connect individuals to mobile crisis teams and crisis receiving and response services, as so many before me have mentioned, and treat individuals' acute needs and connect them to larger or to longer term services that can promote recovery. 988 offers a once-in-a-lifetime catalyst for states to reimagine mental health and substance use crisis response. Not enough states have shown the leadership necessary to seize this opportunity. That is why we are so grateful that California lawmakers and our governor have demonstrated leadership in passing AB 988. AB 988 does a few key things that all states should follow. As Assemblymember Bauer-Kahan and Tara mentioned, it coordinates implementation and long-term planning, which is critical. It utilizes sustainable funding mechanisms so we can long-term fund these systems. And lastly, a cause near and dear to the Kennedy Forum's mission, it ensures health plans meet their responsibilities to cover behavioral health crisis services. Not only does AB 988 set a precedent in crisis response, it sets a precedent in crisis coverage. Behavioral health crisis services are emergency services and should be covered equally to physical health emergency services. AB 988 guarantees that by tying insurers to our state's existing parity laws, which are among the strongest in the nation. California has seized the opportunity that the launch of 988 presented. Other states should follow suit to build out their systems of crisis response and care. We are just so proud that under Assemblymember Bauer-Kahan's leadership and in collaboration with the Sternberg Institute and other partners, the AB 988 is now law. We look forward to realizing the promise of AB 988 in the coming months and years. Like any truly transformative piece of legislation, the signing into law is the first great step forward in a long walk towards equity in mental health. California has met the moment of this national demand, and we look forward to more wins in California and across the country in the implementation of 988. Thanks.
Thank you, Lauren. Very much appreciate your work as well. Our final speaker is Stephanie Welch on behalf of Cal HHS. Stephanie.
Wonderful. Well, thank you so much for including the Health and Human Services Agency, and I really appreciate the leadership both from Senator Padilla as well as Assemblymember Bauer-Kahan in this particular space and championing mental health issues across the lifespan in every opportunity that you have. It's greatly appreciated. I am going to give a very brief update on some of the things that we have underway as the entity that's responsible for implementing this significant policy shift. I'm just going to share a few hyperlinks for you all in our audience so that you can have, let me make sure that I'm doing this correctly, that you can have what you need in terms of some information that you can grab from, I apologize. Here we go. For more information about where we are in the process, a couple of key points I want to lift up. First, we are also incredibly dedicated to preventing crisis. And here in California, we have a number of initiatives underway to build up our infrastructure, both in terms of people as well as buildings, so that we are getting people the care that they need before they are in crisis. So the first two hyperlinks there that you see are links for more information about how to apply for some of these opportunities. The first is for kind of our brick and mortar. So that's how we can create sobering centers, crisis stabilization units, crisis residential units. The second link is we've invested over $200 million in the infrastructure needed to build out mobile crisis units so that if someone does need hands-on crisis response, that a team can respond with a clinician and really de-escalate and link that person to services. Our crisis call centers do such an incredible job supporting people and de-escalating crisis that it's not often that mobile crisis deployment is needed, but we are dedicated to supporting our counties and our communities to build capacity, to build these units so that when it is needed, that they have the ability to deliver. The last few pieces here are just some FAQs that we've created here for California to educate the public about where we are in the process. What I can say is that this is developmental. What we thought was very important to do first was to take the incredible opportunity of funds that we were given at the federal level through SAMHSA and match it with some state dollars so that we could really build capacity of our 988 call centers so that they not only have an excellent call response rate, but they're also trained to work with different populations, that we create more access for people who are non-English speakers. As well as people who may have specialty needs. And so that's where we've really focused our efforts right now. And I'm really proud to say that even with the transition to the simple to remember 988 number, our crisis call centers were able to keep their call answer rate at the same level as they did the year prior. So we feel really equipped to continue growing and building out this system. Agencies committed to accomplishing the planning tasks that have been put before us. And I just want to say thank you again for this opportunity. We're deeply committed here at the Health and Human Services Agency and our 12 departments and 5 offices to transform California's behavioral health system. And that includes giving people the care that they need when they need it. So thank you very much.
Thank you so much, Stephanie. You actually anticipated one of the questions I had as a follow-up, which is where can people go for more information? So thank you for sharing those links. And I think in the chat function, there's links to all of our respective departments, agencies, offices for folks who desire additional information for some follow-up. We are almost up on time, but I do want to make sure we get one other follow-up question from Assemblymember Bauer-Kahan. Assemblymember, back to you for your question.
Yeah, thank you, Senator. I think it's really important what Lauren highlighted, and I want to turn it over to Tara to add in on what can other states learn from us from passing 988, and how can they move forward to implement systems that are robust and as supportive as we hope to have here.
Thank you so much. Yeah, I think it's important to keep in mind that this is a national system, a national number, but it's up to each state to implement the crisis continuum as well as to fund that continuum moving forward. And that's what we were able to achieve with AB 988. And so I'd say there's 3 critical things that were part of our bill here in California and that other states should carry forward. The first is that robust planning and implementation process to make sure that we are building a system that will be responsive to the needs of our individual states and communities, and that we're leveraging the existing resources that are already in our states. The second is that critical funding mechanism via the phone fee. This is a really small fee on phone lines. It's the way we've been able to sustainably fund 911 across the country. And so far, California is only the 5th state in the country to pass any legislation related to 988 that includes a fee. And so we're really hoping that we, along with the other 4 states that have been able to do this so far, will be able to catalyze that action in other states as well. And so please encourage your friends and relatives in other states to reach out to their legislators and push them to do so as well. And then the third piece that I really just want to echo what Lauren said is that commercial insurance piece, making sure that everyone has access to these services and that their insurance will cover it. This is a critical issue that the Kennedy Forum has really been leading in the nation, and that we've partnered with them on here in California. And it's really critical to ensure that that phone fee can fund those services while others are able to access it via their healthcare providers. And we hope all states will follow the model that Assemblymember Bauer-Kahan put forward in AB 988.
Thank you so much. I appreciate the question, Assemblymember, because once again, we get to brag on California. There's so many issues. California plays a leadership role proudly. Not always easy, but important on a variety of issues, including but not limited to mental health. So I know you'll be spreading the word maybe through the National Conference of State Legislators. I know I'll get back to Washington in a couple of weeks, spreading the word with my colleagues, both sides of the aisle, on how we can take these 988 efforts further and holding up the California model as a perfect example. And just in closing for me, and we'll hear from the Assemblymember before we completely close out here, I just want to thank you all again for tuning in and to the Steinberg Institute, the Kennedy Forum, Cal, HHS, and all the other partners and advocates in the work that you do. When it comes to mental health, there has been a decades-long effort, frankly, to overcome the stigma that is associated with mental health. And, as I do in presentations and meetings and conversations, I remind people that, look, if your kid has a hurt leg, you don't hesitate to go to the hospital and get it checked out. Right? If your tooth hurts, you don't hesitate to go to a dentist. And frankly, we try to get ahead of those things by going to an annual physical or get a dental checkup a couple times a year. It's the same thing when it comes to our mental health. It's a proactive check-in. It's a smart thing to do. And if there is any issues, our emotional and mental health well-being, it's the same body we're trying to take care of after all. It's a different part of the body, different organs. And so we should be encouraging people who are in need to get the assistance. Today's webinar has been about providing more of the resources and support that's out there. And again, the tremendous policy work and advocacy going on behind the scenes, whether it's on funding for research or support programs, or even the parity when it comes to insurance. The work continues, and it couldn't be more timely. So thank you all for tuning in to offer some final thoughts. Assemblymember, back to you.
Thank you. And I just want to reiterate my gratitude for everyone who makes these achievements possible. None of us could do it alone. And it is an incredible army of people who work together and use their brilliant minds and talents to make sure we're moving California forward for every single person who needs care, and all the loved ones that we support every single day. And Senator, thank you again for your support every day in Washington. You have a challenging job, and you do it so well. And I couldn't be more grateful for everything you do for my kids' future and for our entire state. So thank you for your service and for your partnership. And this is really the first step in what will be a long, long journey of getting California where it needs to be in the behavioral crisis space. But we are going to get there, and we are going to make sure we're serving Californians exactly as they need us to. So thank you.
Well, thank you so much. Thank you to all the speakers. Thank you for everybody tuning in. We hope you found this helpful. You saw the links in the chat room, and we'll certainly be sharing the copy of this video on our social media platforms. We hope you have a great afternoon, and please help us spread the word about 988.